So thank you for joining us today for the launch of our annual data release. My name is Jan Reimer, and I have the privilege as Executive Director of the Alberta Council of working with amazing women and men all across the province who are members of Alberta's sheltering movement. Before we begin, I'd like to offer our land acknowledgement. ACWS acknowledges the traditional lands upon which we live, work, and play. We recognize that all Albertans are treaty people and have a responsibility to understand our history so that we can learn from the past, be aware of the present, and create a just and caring future. ACWS celebrates and values the resiliency, successes, and teachings that Indigenous people have shown us, as well as the unique contributions of every Albertan. The ACWS office is located on Treaty 6 land in Ameswaskahikan, which is the traditional territory of the Plains Cree and an ancient gathering place of many Indigenous people for thousands of years. These lands have been home to and a central trading place of the Blackfoot, Nakota, Assiniboine, Dene, and the Métis people of Western Canada. We honor the courage and strength of Indigenous women. We honor them as life givers and caregivers, as we honor and learn from their continuing achievements, their consistent strength, and their remarkable endurance. Our members serve all nations and all people. They are located on Treaties 4, 6, 7, and 8 lands across the province, which also include the 6 Métis regions of Alberta. Good morning, and thank you for attending today's launch. The Alberta Council of Women's Shelters represents 39 sheltering organizations across the province who operate more than 50 shelters for those fleeing violence and abuse. Since 1983, we have amplified the collective voice of domestic violence shelters in Alberta, and the annual data release is our yearly update to the community. Before we get into this year's data, I'd first of all like to share a message for anyone watching today who may be experiencing abuse in their own life. Within families, in intimate and dating relationships, abuse can happen behind closed doors, and those experiencing the abuse often fear what may happen if they reach out for help. They may worry about retaliation from the perpetrator, from their community, or that they may not be believed. They may worry that their children will be taken away from them. They may even question themselves if that what they're actually experiencing is abuse. Not all abuse is physical, and domestic violence takes many forms. No matter what you may be facing, shelters are there to help. If you or someone you know is experiencing domestic abuse, intimate partner abuse, or violence in the home, support is available. Breaking the silence takes bravery. But there is one thing we know about survivors, and it is that they are brave, no matter what stage of the journey they are on. To connect with a shelter in your area, you can visit acws.ca or call the toll-free 24-hour number on your screen. Today, you're going to learn that our members are under extreme strain due to chronic underfunding, and they are struggling to meet the level of need in their communities. I don't want this fact, which is in itself deeply troubling, to prevent anyone who needs help from reaching out. But the reality is that the sheltering sector in Alberta is experiencing a compounding of pressures on their operations. Some shelters are even considering closing their unfunded beds, despite being at capacity every night. Some shelters don't receive government funding at all. Today, I am using this platform to call upon government at all levels to listen and to implement the changes we have been asking for years, in some cases decades, to keep women and children alive and safe from harm. If you would like to read about the advocacy ACWS has been engaging in over the last 40 years, please visit our website, acws.ca. There, you can read about the recently announced National Action Plan to end gender-based violence and what we believe is our province's role in that national strategy. Today, I will share with you our most important learnings from the data that we collected this past fiscal year from April 1st, 2021 to March 31st, 2022. It is part of our accountability to our funders, our community, and most importantly, to those experiencing violence in their lives. We have lots to share, and each one of the pages in our data release deserves its own story. The high levels of danger faced by survivors entering shelter doors, and those who can't. The success of shelter staff in supporting women to meet their goals, and the institutional barriers they face. The escalating cost pressures on those fleeing violence and on shelters, to name a few. So to begin, in our 2021 fiscal year, shelters received 65,390 calls for support. Of those calls, 25,530 were calls to request admission to a shelter. Only 16.6% of those calls resulted in admission for the caller. 20,791 calls were requests for information. 16,260 were calls for crisis support, and there were 2,809 calls for other reasons. With more than 65,000 calls coming in from across the province, you can imagine how busy shelter phones are. They never stop ringing morning, noon, and night. And it's not just the phones that are busy. This year, ACWS Member sheltered 7,620 people. This includes 7,555 women and children, 48 men, and 17 who indicated another gender. Of the 7,620 who were sheltered, 6,989 entered emergency shelters, which offer short-term residential support. The other 631 women and children moved into second stage shelters. Also known as transitional housing, second stage shelters offer apartments for clients who need a longer term stay that still offers the safety women are at greatest risk when leaving an abusive relationship, as well as the supports they need. This ranges from some of the basic needs like food to court accompaniment, counseling, addressing children's needs, and much, much more. For those of you who wondered if you heard me correctly, I did in fact say only 16.6% of the calls requesting admission resulted in that caller being admitted. I can't stress enough that these numbers are not just statistics, but living, breathing Albertans, many of whom are in severe danger. Shelters use what's known as the danger assessment, a validated tool developed by Dr. Jacqueline Campbell of Johns Hopkins University that has been used in Alberta's women's shelters now for almost 2 decades. ACWS is one of 4 agencies worldwide that has been granted the ability to certify on the DA training on behalf of Dr. Campbell. It measures a risk of a woman being killed by a current or former partner. Completing the assessment with a shelter worker is voluntary, but it can help survivors understand the danger they are in and make informed choices about their safety. This year, 72% of survivors who completed the danger assessment in emergency shelters were at severe or extreme risk of being killed by their partner or ex-partner. In second stage shelters, this number rises to 85%. This points to the fact that leaving isn't a simple thing and that danger doesn't end once a woman leaves the relationship. Some other things we learned from women who completed the DA. 35% reported being strangled by their partner. 38% that their partner forced them to have sex. 39% that their partner threatened to kill them. And 52% reported that they believe their partner is capable of killing them. And this number is up 10% from a decade earlier and has remained at its current high level for the past 4 years. The danger is real. The need for support is urgent. And when a woman phones the shelter, potentially fearful for her life, what happens when she is told they don't have any room that day? Even if a shelter does have space, they will do, even if a shelter does not have that space, they will do everything they can to assist that person, whether that includes safety planning over the phone, outreach programs, other forms of help. However, there is a big gap between the level of need in our province and what shelters are currently resourced to provide. A large majority looking to enter shelter doors are facing a serious lack of capacity in the system. This past fiscal year, 11,546 requests for admission were by women and seniors who had to be turned away due to shelters being at physical capacity, along with 6,241 children associated with these requests. The lack of capacity in the system impacts children. There were also 7,570 requests that were turned away for other reasons, and 3,336 children who were part of these requests. The shelter may not have the resources in these cases to meet the complexity of the needs safely, or the request for service may not be part of the shelter mandate. The impact upon women who are turned away can be devastating. It takes courage, lots of courage, to leave an abusive relationship. Fear for your children, fear for yourself, fear of financial instability. Many women try multiple times before leaving abusive relationships. Imagine what it is like to reach out for help and be told that where you want to go is full. And there is an impact on shelter staff too. It requires expertise in domestic violence and safety planning, an understanding of the impact of these factors upon children, excellent communication skills, and the ability to navigate complex systems not designed to serve women fleeing violence. For those who staff the crisis and intake lines, having to let a woman know they don't have any space also takes its toll. While shelter staff work to find alternatives with those on the line, the caller may not want to leave a name or a number. The staff member may never hear from them again. What happens to those who can't be accommodated? Where do they go? To speak to this, I would like to invite Linda McLean, the Executive Director of the Brenda Strafford Foundation, one of our members in Calgary, as well as a member of the ACWS Board of Directors. Linda.
Good morning, and thank you, Jan. As Jan mentioned, I'm the Executive Director with the Brenda Strafford Foundation Heart Home Network. We are one of 3 second stage shelters based in Calgary, and we operate with what's called a shared intake process. What that does is it allows a woman and her children to make a single application and be considered for a unit at any one of our organizations. So reducing the amount of effort and strain on the woman seeking support. We have begun in recent time to create wait lists to reflect the fact that we are receiving more demand for service than we can meet with our supply. And that hasn't always been the case. Not all shelters reflect waitlist data as part of their intake procedure. And what that means in terms of the data released this year is that the turnaway numbers actually look a little lower for second stage shelter, because those people who might previously have been counted as turnaways are actually being reflected on our wait lists. And that wait list, sadly, is growing. It's at its highest point since 2019. And the reality is that survivors are waiting a very long time to be able to access second stage shelter, which is a critical part of the continuum of care. 21 or 30-day stay in an emergency shelter goes by very quickly. And when you are putting a life back together after potentially having lost everything in that exit from that abusive relationship, that time is not adequate. It is absolutely critical that women and their children have a more extended period of time to be able to work with the supports necessary to successfully transition back into community and live independently. We are most definitely failing if we are exiting women to greater instability than what they've come from. So just looking at the numbers right now, and it's deeply concerning. Survivors with children in their care are currently spending an average of 1.5 months on our wait list. So 6 to 8 weeks before they're able to access a second stage shelter unit and make that transition. Single women, without children in their care, are waiting as long as 6 months, some longer, 6 months. And trust me, those are long time periods when you are in crisis and when you do not have options. What that means in reality is that we currently have confirmed evidence that women and women with children are living in their cars, negotiating with kindly businesses to make use of their parkades so they have a place to park that vehicle overnight. We have women who are literally sleeping rough in tents with children. Just recently, I served a woman, a single amputee, Indigenous family, 4 children, who had been sleeping rough in a tent along the riverbank in Calgary for 3 months, waiting for a second stage shelter bed. Some are living with relatives, which can be a supportive situation, but more often is a very stressful situation because it may be putting strain on everyone. There may be conflict arising because of cramped quarters and the lack of resources to support those additional house guests. And in a lot of cases, women are making that choice to return to an abuser because they don't have another option and they're not willing to put their children through the stress of not knowing where they're going to be sleeping tonight. So that's our reality, and we need to understand that domestic violence is one of the biggest contributing factors to homelessness among women. Talking to women experiencing homelessness, almost 100% will report that domestic violence has been part of their experience. And it's being compounded by the fact that we currently have a really serious housing crisis, a perfect storm, if you will, in the province, and particularly in my location in Calgary, where the very low vacancy rates, the very high rental market costs, and the fact that it's a landlord's market are making it increasingly difficult for women to be able to find safe, affordable, appropriate accommodation and move on with their lives. It's being reflected in our second stage shelters in the fact that we are literally bottlenecked. We've got a lineup of women and their children waiting to enter, and we've got a lineup of women who are currently residing with us who can't exit and free up that space so that women can come in to receive service because they don't have housing to exit to. And this means that we're looking at all of these critical factors: affordability, appropriate accommodation, safe accommodation. How do we ensure that that safety stays in place after we are exiting women to community? And of course, poverty. So many of the women that we are working with, as a consequence often of having to leave an abusive relationship, are finding themselves in really desperate economic straits that does not really set them up for success in transitioning to independent living. If people don't have a safe place to go, they make desperate choices. And we're seeing that every day, having to make really untenable choices. Returning to an abuser is often top of that list because it will at least be a place where they can go and have a place to sleep every night, regardless of what that situation is going to be like on a living basis. The most common factors that are contributing to our wait list are, one, of course, just increase in demand and the experience of domestic violence within our communities and across our province. The other issues have to do with our capacity. You know, we have a finite number of units and sometimes what feels like an infinite number of people seeking support. And then the other piece that gets more complicated and is not as easily resolved, it's not just about adding more units. It's about having the right units, the right service at the right time. When we have, for example, a woman presenting needing access for second stage shelter, and she's got 4 children. Well, in my building, at our facility at the Brenda Strafford Foundation, our units are 2-bedroom units. It's very difficult to house, obviously, a family of 5 in a small 2-bedroom apartment. And sometimes we're seeing larger families, you know, 5, 6, 7 children. And so we're not able to serve them because we literally do not have the appropriate physical space. So we're needing to start to think about how can we build flexibility into our system. Who will step forward to support us in creating space that could be expanded and contracted to meet the needs of really diverse populations that we're serving. We need a variety of housing. You know, for larger families, small 600-700 square foot apartments are not appropriate, and we need to have different space. Another thing that comes up a lot is pets. Pets are family members, and we are often not able to accommodate the pets depending upon the size of the dog or how many pets there might be. And women will often refuse to leave a situation if they have to desert those animals and leave them behind. Not to mention the trauma on children of having to leave their beloved pets behind. We're also seeing significantly longer stays in second stage shelter. In just recent memory here, I've seen an almost 40% increase in length of stay in our second stage shelter units, which is quite frightening because it's just compounding that bottleneck. But we also know that those longer stays are necessary. If we're really in the business of exiting people to success and to a change trajectory where they will live lives free of abuse, then they need the time necessary to rebuild lives, acquire the supports, and start off on that new path so that that choice to return to an abuser is not there because of ongoing vulnerability. So yeah, we were definitely needing to have you know, that recognized, that a longer length of stay isn't necessarily a negative thing, because ultimately it means that we're setting people up for success, and the systemic costs across the board will go down because those women have received the right service at the right time in the right way. So thanks so much, and I'll hand that back to you, Jan.
Thank you, Linda, and thanks for that. It's really creates a compelling case for the need for the capacity and the right services at the right time. Thank you, Linda. And I'd like to now introduce Michele. Michele is with Seniors Safe House with SAGE Seniors Association of Alberta. And senior shelters focus on supporting older adults who've experienced violence and abuse, and she'll provide some perspectives on elder abuse across the province.
Good morning. Last year in Alberta, 69 older adults were admitted into senior shelters. There are currently 2 ACWS member shelters in the province that are dedicated to serving older adults. SAGE here in Edmonton, where I'm from, and the Kirby Centre in Calgary. Older adults experience intimate partner violence, but can also experience abuse from adult children, grandchildren, or other family members, and an increasing number are experiencing abuse and harm from roommates. Most seniors requesting help are experiencing emotional, financial, and/or physical abuse. Many of the older adults we support in our shelters live with vulnerabilities and complexities often associated with that stage of life. Some are dependent on the person who is harming them to have their basic needs met, such as access to food, shelter, and even medical care. We know, and research tells us, that many older adults live with isolation and poverty, and these experiences contribute to their vulnerability to abuse. We have had many older adults come into our shelters who have made the decision to live with family members or with roommates in an attempt to reduce the financial stress and experience of loneliness, only to have that situation go badly. The majority of older adults who enter our shelters are abused by an adult child who themselves are dealing with issues of substance abuse, poor mental health, and poverty. These relationships often exist within complex family dynamics, intergenerational trauma, and sometimes a history of family violence. We have older adults whose loved ones are unhoused and impacted by the opioid drug poisoning crises. It is not unusual for an older adult to say they don't need help for themselves, they need help for their adult child. As Linda had mentioned, the population we work with faces a similar challenges in accessing safe and affordable housing. We are a 60-day stay shelter. However, half the people we served stayed more than 60 days, with 6 people staying well over 90 days, one of whom was with us for 285 days. Because of her limited options based on her income, her age, she was just under the age of 60, so therefore not eligible for seniors affordable housing, and she needed an accessible suite. Having people with us beyond the 60 days has an impact on our ability to bring in other people into the shelter, of course, just as Linda had said. We employ a wait list, and our intensive case manager works with those older adults waiting to get into our shelter. Either they're housed at another shelter, they're staying with a safe friend or family member, or sometimes they're choosing to stay in that unsafe situation with this active safety plan in place. I believe that we are all aware that we live in an aging society here in Alberta and in Canada. And for us, that means that there's even a greater importance to work towards the prevention and intervention of elder abuse, including looking for safe spaces for those older adults. Thank you.
Thank you, Michele. For those who are wondering what they can do to help, I encourage you to donate to your local shelter if it's within your means to do so. You can get the contact information for our members by visiting our website, acws.ca/shelters. The reality of it is that we currently have a system where project grants and private charity is filling in for the massive holes in the social safety net. The result of chronic underfunding is that there is a staffing crisis that is making it very difficult for shelters to respond to the needs in the community. Domestic violence shelter wages and operating costs have not been increased since the 2013-2014 fiscal year. Inflation rates alone, based on the Alberta inflation calculator, dictates a 20% increase and increasing, as we know. And this does not fill the wage gap that also exists for domestic violence shelters programs, nor recognize that the current provincial staffing model does not fully reflect today's operational needs. To speak to some of the challenges taking place across the province with respect to staffing, I'd like to invite Carol Manson McLeod, who is the Executive Director of the Wheatland Crisis Society in Strathmore, to share about the current situation.
Good morning, Jan, and thank you very much for the opportunity. I first just want to thank and acknowledge all of the staff that are working in this field. They are passionate, values-driven individuals and make a difference every day to the clients that we serve. Due to the wages being lower from comparable sectors, for the most part, we are only able to hire entry-level staff. As you can imagine, when people coming into this field, it's an extremely demanding field, which requires high levels of knowledge and experience. And once they attain that experience with us, they often end up moving on to higher paying jobs out in other sectors or similar sectors. And you can understand this is extremely complex work. Each individual's case is different, and each individual case needs individual planning in order to help them move through into leading a successful domestic-free violence life. You can imagine there's extreme skills that are needed, and that when we lose the staff to higher paying jobs, we lose that experience, and it becomes more difficult for us to develop safety plans that are potentially not realistic. Maybe pieces are missing, and our clients really are being not resourced properly. You can also imagine as we have the turnover of staff, onboarding takes time, resources. It takes months to years in order to gain the skill set they need to work in this area. It takes time for new staff to feel completely comfortable with their roles and responsibilities. and which impacts the care that we're able to provide. Many of our staff will leave our agency for other government positions, Alberta Health Services, et cetera, that offer higher wages, better benefits, and a retirement plan. And you can imagine now as costs are increasing. Jan mentioned that we haven't had an increase since 2013, 2014. And many of us do not have the ability to increase salaries where they need to be in order to even have a living wage. It's difficult to attract and retain staff because we don't have competitive wages, and often some of our staff now are forced to get second jobs because they are so passionate they want to work in this field, but they're forced to get second jobs. They leave us short-staffed way too often, and at times, as my colleagues have mentioned, we've had increasing numbers coming into the shelter, and we often don't have enough staff to be able to support them and to provide the level of care that we can and want to deliver. Many times we're just getting by with barely enough staff, and as you can imagine, this causes burnout and turnover, which directly impacts the care that we're able to provide. Our staff are amazing and they provide services, the best service possible, but the needs are high and ever increasing. The phone calls, and just taking the phone calls is a demand. It takes time away from us being able to provide the care as well. Stagnant wages have created an inability to recruit and retain our most valuable resource, our human capital, and those experienced individuals. It creates a domino effect with missed opportunity to provide the supports, advocacy, creating additional barriers, creating the relationships within the community, and it's causing frustration and lack of confidence and distrust in our system. Clients are often going back to dangerous situations, creating even more safety concern. And the lack of movement and stagnant wages is contributing to the limitations that we can ensure to provide safe and reliable resources to our communities. I implore you, it's an extremely important issue that we need to address.
Thank you, Carol. Really appreciate how you've given that overview. It's really challenging to try to meet all those needs when staffing resources are stressed so thin and they want to do so much for women. We know, in fact, that many Albertans are struggling at the moment, and a recent news segment reported that the number of Albertans accessing food banks shot up this year by 73%, almost double what other provinces are experiencing. Poverty is on the rise in Alberta, and poverty continues to be a significant factor in the complexity of many clients served by shelters. While many shelters have a mandate that focuses on women who are in crisis because of domestic violence, many also serve as a hub of support for people in need in a community. And in many places in Alberta, they remained open during the pandemic while other agencies closed their doors. One of the best tools we have for reporting on the positive impact shelters make on the lives of their clients is the goal attainment tool, which measures the progress clients make as they work towards rebuilding their lives. Clients set goals for themselves during the intake process and report on their progress. Goal attainment can also help to identify areas where systemic barriers are limiting clients' ability to meet their goals. In 2021-22, clients who participated in the goal attainment started encountering more barriers, particularly in the areas of basic needs, prescriptions, dental care, clothing, food security, in addition to legal issues, employment, education, and housing. However, over 80% of clients did make progress on safety, childcare, parenting, and physical health goals, which speaks to the survivors' incredible determination to care for themselves and their families, even through the most difficult of circumstances. In spite of the struggles they encounter, shelters are there each and every day, supporting women, children, families, and seniors to make real and tangible progress on their goals. There are systemic issues, though, that even the most dedicated shelter worker cannot fix. They cannot build housing in a day. They can't provide a basic income. They are not lawyers. But on the goals that shelters are able to support, they have a remarkable impact. Lives are changed for the better, and shelters are a big part of that supporting clients as they make positive changes in their lives. I'd now like to call upon Cindy Yang, Director of Strategic Priorities at Stepping Stone Crisis Society in Cold Lake, to speak about the Impactful Community Kitchens program and the work that they're doing to address the need. Cindy.
Thank you. We launched Community Kitchens in February of 2019 to support the women in our second stage housing program develop important kitchen skills to support them in providing healthy, nutritious, and budget-friendly meals for themselves and their children. Very shortly after that, we expanded the program to support our outreach clients and then began including participants from multiple other agencies. Not only did this program teach valuable food skills, it allowed moms the opportunity to interact and to connect with other moms and build lasting supports. When COVID-19 hit, we shifted our program to the Second Helping program as so many of our clients were facing food insecurity in addition to all the stresses of the pandemic. So this program offers free, nutritious, and fully prepared meals 1 day per week. This has grown to provide meals for clients facing food insecurity who are not necessarily clients of our shelter. Because we had a grant to offer this program, but not a location where we could have people stopping in to pick up the meals for safety reasons, we offer the meals to those who are also accessing other supports. This is set up so that workers from other agencies and programs like Healthy Babies, FASD, our chaplain's office, they can notify us with how many meals that they would need. And then that agency picks up the meals and distributes them to the community members in need. We've also recently begun working with outreach workers in the schools as they're noticing that children are going hungry and going without food. We have set up a second day per week for the schools due to our capacity to provide family meals where needed. Our grant is currently done, and while we're ready now to switch back into in-person community kitchens programming, the food insecurity amongst our most vulnerable community members is in fact increasing and not decreasing. So we are looking for additional funding. At the time that this data was collated, we had provided over 5,600 meals, and our community members really rely and count on these weekly meals. So with that, I'll hand it back over to you, Jan.
Thank you, Cindy. And to add to what both Carol and Cindy have said, over a third of shelter workers have taken second jobs to supplement their salaries, which are in some places below the living wage in their community. We also learned that at least one of our members is using their food security program to support staff as well, given the inflationary pressure staff are facing in their community. And in one community, the food bank has not met the needs of women for years due to the limited number of hampers they are eligible for on an annual basis. Shelters are desperately trying to fill that gap. In one shelter, their food budget rose from $6,000 pre-pandemic to $60,000 this year, an increase that is simply not sustainable without more support. Right now, it is imperative that people donate to shelters when they can, but even more important than private donations is change from the top. Decision makers at every level of government need to understand that change is needed. We need to let them know that it's not acceptable for these circumstances to persist. Before we end this presentation, I'd like to speak about how shelters provide much more than a bed. In addition to the violence intervention work they do, the life-saving and the life-altering work they do, prevention is another key component of their activities. Educating and connecting with people as we work towards a world free from violence and abuse. Our members are in schools, they work with children, they undertake awareness campaigns, and much, much more. We also have members working with us as part of Leading Change, the prevention arm of ACWS, which offers tailored, gender-based violence prevention training to workplaces, schools, government, sports groups, and communities. ACWS member organizations participate in Leading Change initiatives through a train-the-trainer model and are given tools to lead violence prevention work in their own local community. We're excited to share with you the impactful work that Leading Change has initiated. Recently, we began working with young hockey players through a new partnership with the Alberta Junior Hockey League, with more training to come in 2023. The training focuses on building a strength-based conversation among players about domestic and gender-based violence prevention. We're also pleased to be working with employers who share the passion for making change, and we are bringing domestic violence in the workplace training to organizations across the province. During the COVID pandemic, Leading Change adapted its programming to meet the changing circumstances and ensure that gender-based violence prevention work continued to make progress across the, even with the global health crisis. In 21-22, Leading Change facilitated both online and in-person activities, including new training that has been specifically developed for family lawyers in recognition of the new Divorce Act. We also continued to distribute the Leading Change Expansion Pack, which is a subscription-style box filled with activities and information to help people better understand how they can be actively engaged in interrupting and changing cultures of gender-based violence, and that they can work through at their own pace. Last year, we reached over 6,400 people through the Leading Change programming. It's a well-evaluated program developed with Dr. Jackson Katz. We hope this work will one day reduce the violence that we see in our communities. You can also learn more about Leading Change programming for your workplace, sports team, or organization, and find out more on our website. And that is, I guess, a real overview of all the amazing work that our members are doing across the province. And thank you for joining us.
There are a few questions, Jan. I will give you the question and let you know where it comes from. Comparing this year's report to last year's, it looks like there's been a 25% increase in calls for support and the same increase for emergency admissions. What's behind that? Did admissions decrease during the pandemic?
We saw an interesting phenomenon during the pandemic. At the start of the pandemic, when there was that messaging of stay home, stay safe, the phones really went silent. I think some of our members were actually picking up the phone to see if it was still working, maybe, and it wasn't Shaw outage like we had today. But I think that one of the pieces that members really had to deal with was as each wave changed and it increased, the number of calls went down. But with each wave, we had more and more calls. So we're now in the, I won't say we're post-pandemic, but we're post-restrictions. And we're seeing more and more calls come to shelter. And indeed, since we pulled this data, our members are reporting even more calls and even more demand for their services.
Thank you. And a follow-up question. This is also from Madeline Cummings of CBC. What are you requesting, if anything, from the provincial government, which is sitting on a surplus right now?
They need to address the skimpy shelter wages for sure. The staffing model is antiquated. And, you know, they need to address the operating costs immediately. This is a significant challenge for our members all across the province. And it really vitally needs to be addressed. We can't have shelter workers working 2 jobs. We can't continue to sustain the challenges that we're seeing in terms of turnover of staff. And we need to address that by addressing their salaries and addressing their operating costs. If you think of the one shelter that went from 60 to 60,000 in terms of their food costs, it is just simply not sustainable.
Thank you. I have a question from Emmanuel Prince-Tovet of the CBC, asking, in the report, you mentioned that 16.6% of those calls resulted in shelters being able to provide admission to the caller. Where did we obtain that percentage? Could you explain which numbers we're talking about?
Yes, that's part of what we collect for our data in terms of the calls to shelter and those calls that resulted in admissions. So that's where that number was calculated from.
You report that we're seeing a return to the pre-pandemic needs. During the pandemic, I understand that it was more difficult to provide services, but did the needs go up?
I think the needs have gone up because we've seen, in addition, the complexity of cases that people are seeing. We're seeing the challenges with food security. We're seeing mental health and addictions issues certainly that are arising as, through the pandemic. And then you layer on that what the UN has called the shadow pandemic and the opioid crisis, as Michele referred to in her comments, and that impact on elder abuse. So I think we're really can anticipate an increase, actually, even more than what we are seeing in terms of domestic violence and abuse. So yes, things are definitely increasing and going up, and we're seeing that as it's played out over time.
What stood out to ACWS from the data? Was there anything surprising or concerning?
Oh, so much that's concerning. I think the lack of capacity overall in the system is a huge problem that has been not addressed for many years. And and as I said earlier in my comments, these are not numbers. These are people. They're women, they're children, they're seniors, they're families. That need needs to be addressed. And yes, we all want to prevent domestic violence, but we also have to meet the needs of those who are trying to build a safer life and provide them with the supports they need. I think another thing that stood out for me was the increase in shelters having to provide the most basic of needs because our social support systems are failing. And when you're having to purchase food as part of your budget for women who are staying in second stage shelter, it's a challenge. So there's so many different things that are happening that out there. But I think that just what we're seeing in terms of the mental health, the addictions, the lack of salaries and the staff turnover, like they're all issues that play off each other. I don't know if you could just say there's one. It's that multiplicity and complexity of all the issues that shelters are dealing with in very, very challenging circumstances.
What supports are most needed in smaller municipalities to address resource concerns for women fleeing domestic violence?
Well, we heard from a number of shelters for resources, in terms of everything from food security to appropriate staffing. We know too, in rural areas, transportation has been a perennial, persistent problem. But again, and actually one of the shelters I refer to that's looking at closing their unfunded beds is, serving a large part of rural Alberta. So those appropriate funding levels, I think for rural members, they have less resources to draw on often than some of the major cities because sometimes they're the only show in town. And so they really do need that support, both in terms of their operating costs, their staffing, addressing transportation needs for women. And also, I think looking at how they can have relationships with some of the agencies that are just coming back from the pandemic that may not have been there during the pandemic.
You said in the report that shelters need appropriate funding. Can you be more specific? How much money would you like to have and from whom?
Well, the province funds most of the women's shelters in Alberta, and they need a minimum of a 20% increase in their operating line. And I think probably we calculated that inflation calculator. I think it's probably gone up, but we need a type of contract that recognizes the inflationary pressures, and we need that inflationary catch-up as a bare minimum for shelters across the province. So that would be, I think, the key ask that we would want to see. The other, I think, would be, because we know the National Action Plan is coming down the pike with funding, so the province is going to have 50 cent dollars. They need to use that plan to build stability in our sector. And they need to have a plan, not just a series of projects that they're announcing. We need a good plan going forward to meet the needs of women fleeing violence.
Are there parts of the province where you're seeing more demand for admissions than others?
I think it's a problem all across our province, and Alberta sadly has had some of the highest rates of domestic violence over the years for a very, very long time. So this is not unique to any one community. And there are communities out there struggling now. They want to build women's shelters because they don't have the resources. So I don't think there's any community that's immune for this or where there's a greater or lesser need. There are needs wholesale across this province.
And last question, shelters are turning people away because they don't have the resources to meet their needs. Could you give examples? What could be done to support women with complex needs?
Well, I think having mental health and addiction support would be one. Having access to housing and priority housing. We understand there may be some regulations coming. We haven't seen them nor been consulted on them, but we understand there may be some changes there that may improve women's access to social housing that we currently don't see in this province. So there are some things that could be done around systems of accessing income support that would also help. And we're hopeful that the province will respond in those areas as well.